am Barbara Jors, the President and CEO of Gillette Children's Specialty Healthcare, located in St. Paul, Minnesota, in the upper Midwest of the United States. Gillette Children's has a long history. We're over 125 years old, and our mission is focused on conditions impacting the brain, bone, and movement of children. So we specialize in musculoskeletal and neuromuscular conditions that often lead to disabilities that our children live with. And we focus on their complex medical needs, and they often live also with rare disease. Gillette Children's joined the International Hospital Foundation in 2019. And in those 5 years, we have bolstered our ability to collaborate with remarkable colleagues and organizations across the globe. And in that work, I've enjoyed numerous opportunities to serve alongside many of you, both on the scientific committees and on the awards committee, as we work to help each other come further and to make better improvements for those that we serve, regardless of the country that we may reside in. So at Gillette Children's, our subspecialties include orthopedics, physical medicine and rehab, neurosurgery, neurology, complex pediatrics, and related adult care. And when we bring together those teams of specialists and all the number of staff that are trained in those areas as well, we specialize in complex and rare disease and conditions. Cerebral palsy is the most notable of our work, that we collaborate with many of you around the world in gait and motion, use of technology like pumps, and other ways that we can help a child with their motion and mobility have a more rich childhood. We also, in that work and with those specialists, focus on rare conditions such as Rett disease or spinal muscular atrophy. And another area in IHF where we collaborate is working with those rare diseases. I'm honored to have been a founding member with IHF to find the Global Rare Pediatric Disease Network, of which we will be meeting down in Rio at the Congress, and working together to say how can Gillette Children's specialty care, along with the specialty care at other members across the globe, work better together to advance research and clinical care for some of these devastating conditions. We know from the World Health Organization that climate change is the single biggest health threat facing humans. Climate change disproportionately impacts patients with complex medical conditions, those at Gillette Children's and across the world, those living with disabilities. So for example, if a child uses a power wheelchair and relies on electricity for that mobility, for their oxygen, severe events that are increasing, such as power outages, storms, floods, hurricanes, can make it very difficult for those individuals to get to safety and to access the necessary resources they need. They also stress the emergency preparedness and response units, as oftentimes individuals living with complex medical conditions and disabilities need so much more support in that safety evacuation and related incidents. As climate change intensifies, in addition to doing our part to ensure sustainable practices within our own ecosystem, we feel incredible responsibility to play a role and to share our expertise to advocate for our patients and for those around the world living with disabilities. We seek active opportunities to advocate for better climate practices. In fact, here in Minnesota, we sit on the Minnesota Governor's Advisory Council for Climate Change, and our Chief Medical Officer is the only physician. So together with the World Health Organization, International Hospital Federation, we are strong advocates to assure that physicians and clinical specialists are included in the world's climate change planning because it impacts people so directly. Absolutely. We are attending the World Hospital Congress in Rio this September, and we very much look forward to seeing all of our colleagues, especially helping to host a lunch to discuss the challenges for the global pediatric rare disease community. We enjoy working with all of our colleagues around the world, and we're very energized and look forward to traveling soon.